following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Welcome to Gate City Chronicles. I'm Kevin Avard, your host, and I'm proud to introduce my guest for today. I have Craig and I have Linda from
Healthy at Home.
Healthy at Home. I told you I'd forget it.
That's
it was
all right.
just 2 seconds and I forgot it. That's fine. Healthy at Home. Welcome to the show.
Thank you.
Thank you.
So Healthy at Home, in a nutshell, what is Healthy at Home? What
Healthy
do you
at
do?
Home is a home care agency where people go into your homes after hospitalization to get personal care, bathing, hygiene, rehab. If you need housekeeping done, we provide that. We pet sit.
You pet sit?
We do.
You actually walk the dog. Now, that really is important to the owners, isn't it?
It is, especially when they're in the hospital or they've gone away. A lot of the family members will say, I want to take my mom and dad to our house for a week, but we don't have anybody to watch the dog and we don't want to kennel them. So we go twice a day and walk the dog, feed the cat, and especially when someone is in the hospital as well.
That could be one worry that just throws them over, isn't it?
Mm-hmm.
I mean, if you know Sparky or whatever, I don't like him with that name, but it is not doing well, then obviously that's a concern. You're not focusing on getting well. So a little bit about your background, Linda. You're a nurse since
1976.
That's the spirit. I keep saying that. I heard that on the Three Stooges years back. 1776. And you also were a nurse in the Army.
I was in the Army Nurse Corps for 8 years at Walter Reed. Very proud of our veterans, of being a veteran myself. That's where I got my master's in health administration, and I've always wanted to do home care because people can stay healthy in their home. It's a lot less expensive than a hospital or a nursing home, and you can receive everything. Our experience is that the people feel more safer, comfortable, and heal faster, to be honest with you. And with today's healthcare, with the reform and the ACA, that's Affordable Care Act, they don't want anybody going to the ERs to visit, so they don't want anybody going to the hospitals. So our job in home care, and Craig can attest to that, is to keep them healthy at home. That's why we named our agency, I Want to Be Healthy at Home.
Now, how old is this agency?
1997.
15 years.
Who's the founder?
The founder is Peter Kelleher, and he's the president and CEO of Harbor Homes.
Of Harbor Homes, okay. So that's something, a sister company?
We're an affiliate of Harbor Homes.
And I think we had Harbor Homes here on the show at one point.
You probably did, talking about the veterans.
Veterans, that's right. As a matter of fact, I dropped off some pots and pans. They're right next to the post office. You look for the flag, and right off of Spring
Street.
Right, and I walked in, I said, can you guys use some pots and pans? Yeah, they were happy to take them, so that's fine.
Right, definitely, and we provide home care for them too. A lot of them need injections or medication training or personal care or physical therapy to get them stronger. So,
Craig, you're a nurse as well, and you've been...
I've been with the company 10 years, and when I was looking for a place, I wanted to do the best I could, and Healthy at Home was, to me, the best fit for myself as to being flexible and working with the less opportunistic community, per se, maybe.
This is really hands-on stuff.
It is, and we deal with the gamut of from psychiatric to cardiac.
Yeah, you were just talking off air just a few minutes about like comorbidity. It's a new word that I learned today that has to do with a person who has...
Person comes out of the hospital and they're diagnosed with CHF, congestive heart failure, but they also have, they're a type 2 diabetic, and they also have, say, asthma.
Right.
So
It could be anything, right.
it could be anything. Those are comorbidities.
And so that makes it a tough day. You got to deal with one thing. There's certain medications that you have, and then and now there's other things that you don't want to mix the medications at certain times. You got to have it with meals.
Right, and you have to, when there's comorbidities, and today, it's not like years ago when there was a doctor that took care of the whole entire person. Now it's this doctor you go to for this doctor you go to for that. So everyone's doing prescribing, but who's doing the check on like all their medications and making sure that they don't interact or that they work well with the patient. So you have to do that.
The mode or the what's going on. It's the theme of the now. It's the best thing to be.
They're trying to get everything computerized within like pharmacies and making sure that people aren't on the same medications, but it's still not closed in yet.
It reminds me a little bit, and I remember watching this show years ago. You ever hear of Marcus Welby?
Oh yeah.
And we all used to say, whatever happened to Marcus Welby, MD? Well, this is kind of that on steroids, because now you got a nurse coming in, you've got somebody walking. Dr. Welby didn't necessarily walk the pets, but right, you're really hands-on, and
you take care of the whole person,
right.
Not just one piece of it. Like, we don't go in and just take care of your health issues. We take care of your home, your garden, your families, the families involved, and if you're not fortunate to have a family that can help you, we will become your family.
How do you get in touch with the doctors? How do you work with the doctors if you're not in the home?
You call them up, and you make it so that you're telling them what your findings are, and hopefully you have a good rapport with the physician, and the physician is relying on your assessment, whether they need to come, whether they need to come in, or they need to go to the hospital,
right.
So you're basically the physician's eyes, obviously.
They really count on home care nurses. No, they really do. There's a great relationship, because, yeah, it's like I really think that Craig needs some more Lasix. His swelling in his ankles are high, and why send him to your office or the ER for a $400 minimum visit where we can go in for $35 and give you an extra set of Lasix, or that's a fluid
and they can't
evaluator.
walk it, and half of them can't walk. They're having trouble. So to go to the doctor's office, they've already been put on it. How about I make suggestions to the doctor, and sometimes it works, sometimes it doesn't. It depends on your rapport, how confident the doctor feels you are.
Which brings up another, it's a hindrance to all people, all ages, that they can't get there. It's so hard to get out. They don't have the transportation.
Right. You either have to take a bus or take a cab.
Right.
And
So
the whole process from getting from the car to the cab could be a big deal.
Right.
So
if we can give them a full rundown of how they're feeling between their blood pressure, their pulse, are they do they have productive sputum or whatever? Give them as much information as we can assess, and they can go from there. Sometimes, a lot of times they will, follow what you say.
Right. Linda, when you walk into a house, probably the last thing somebody's going to ask you, are you bonded? Is that an important issue?
It's very important.
Why?
Absolutely.
Anybody that's receiving or wants to receive home care should always ask the human resources person, what makes you better? What kind of things do you have in place? So the bonded is in case you have an employee that goes in and steals someone, they break something.
Right.
There's a legal issue. You want to check their criminal background too. Don't let anybody work.
But if somebody's sick, how do they go through that process? Oh, you're at the door.
It's very hard, because if you don't need home care, you don't even want to hear about it, because everybody's life is so stressful.
Right.
So then when you do need home care, you don't know what to do. So we just want to put out there, call the home care agencies, to get information. Are you bonded? Are you secured? Do you do criminal record checks? Do you do sex offender checks? Because home care agencies that are Medicare and Medicaid certified, that accept all insurances, they can't hire anybody that's had a felony, because we bill the state and federal monies.
Right.
And it's illegal.
Right. So you have to screen all the employees. You must have, how many employees do you
We have
have?
100.
100 employees. So there's quite the screening process.
We have 200 clients.
Do you interview each one of
I
them?
do, every single one of them.
You look them in the eye and
I do.
give them that quick handshake.
The quick handshake, I say, hi, my name is Linda, nice to
Right.
meet you. But that's what I insist they all do when they meet a client.
Right.
You know, it's nice to meet you. We're in your home, you're the boss.
Exactly. Yeah. And
We're a guest in their house.
Yeah.
do you when you go into the home, you ever see that show Buried Alive?
I have.
Where you know, people have like a dump in their home. I've seen people being cared in those type of environments. Do you ever walk into stuff like that? I mean, do you?
Sure we do.
Yeah. How do you work with that?
You have to make sure that it's a safe environment for them. And if it's not, we need to contact, we have a duty to contact, you know, what is it?
BEAS, Bureau of Adult.
Right. But other times, I mean, you know, everyone lives a different way, and we can't say no because they're hoarders, or no because the floor is dirty, or they have cat hair all over. You know, we're there to provide a service.
But if it's in an extreme environment, you know,
if it's an
some
extreme,
people don't realize, you know,
or
it could be a mental
unsafe.
issue. Right.
But otherwise, we manage.
Right.
Judge not unless you want to be judged.
Yea,
I
verily.
mean, everybody
There you
needs
go.
the same respect, and I would say we say yes to everyone because they all have their own story.
Right.
And there are very few that are really out there.
Don't judge a book by its cover.
And there's behavioral health issues out there more than anybody wants to acknowledge. They're probably the easiest people that we work with because they have that feeling that we're not judging them, that,
Right.
all right, you're not going to smoke and you're going to drink, so what can I do to help you keep you at home?
Right.
You know, I know you're not going to quit, or, you know, and there's a lot of agencies that will say, forget it, if you're not going to follow the care plan, but it's their life, it's not mine. So what can I do to make you feel comfortable in your home but stay healthier? Could you cut down or not smoke while I'm here?
There's
Could
a
you not
trust
pick
issue
up a
there.
drink till 11 instead of 9?
Right.
You know?
And you can help them on that, and I'm sure they appreciate that.
When I first came to Healthy, Linda gave me a patient, and I look at the diagnosis, and it said schizophrenia. I'm like, well, you know, it was all new for me, basically. I mean, I never thought I'd come into a diagnosis and go meet this patient. I said, you wanted me to take on a schizophrenic patient? And she says, yeah, he's fine, and he's stable. I said, oh, okay. And from that point on, it was like, they're just like anybody else.
Right.
They just
You know,
have a
they're-
chemical imbalance.
They have a chemical imbalance, they're treatable, and you help them along, whatever they need.
And the population is about a third of our population. The majority of our population are your older people that we serve, about between 60 and 102 years old right now.
Wow, 102. Yay.
Yeah.
You're
Yeah.
doing a good job.
Yeah.
Yeah.
So, talk a little bit about, you know, the providers. Obviously, you're a provider, but also the Medicaid. You get the ACA. You get Medicare. There are all kinds of people that are paying for this. How does all that work? Do you accept everything?
We do. It's with the managed care coming into place, it's really been well needed. Although until New Hampshire decides to expand Medicaid, there'll still be people that will fall through the cracks. And
I
that's
think they just expanded Medicaid
oh, good.
quite a bit, actually.
Well, I mean, last October, New Hampshire accepted the 3 managed care contracts, the WellSense, New Hampshire Healthy Families, and Meridian. But
Humana.
there's still a piece where they didn't do the expansion, so there's a set of people that if you make less than $19,000, you will fall through the cracks if you're a single person.
If you don't make 19,000?
Correct. If you make your poverty level is considered for a single person making 19,000 some odd dollars or less.
And that allows you to be qualified. That doesn't allow you to be qualified for Medicaid?
Not in the state of New Hampshire,
So you
because the
have to
state
make
of New
more than
Hampshire,
19,000?
no, you have to make less.
Less.
But what happens is in the state of New Hampshire, along with other states, some states, the Medicaid eligibility is based on a disability of 2 or more years. Where many other states, when you do the Medicaid expansion, it's based on your income.
Okay.
So that's where New Hampshire hasn't come into fruition yet. And they're all talking about it, but we don't know if it's going to go through. We're hoping it will. So does that make it, am I explaining
Sure.
myself
Yes.
correctly? Is that In New Hampshire, the only way you can get on Medicaid is not your age, but by having a disability. And by having Medicaid expansion, what Obama, wanted and everything, into the state is so that everyone has health coverage.
Right.
Regardless. So I may be making $19,000, but I'm walking and talking, and I'm not going to be eligible in the state of New Hampshire because I don't have a disability, a physical disability. And they don't consider behavioral health, schizophrenia, a disability.
Disability,
It
right.
has to be a physical disability.
Now,
Right?
do you go to all levels of care? I mean, do you do? I'm
We
gonna ask a
do, we
dumb
do
question.
wound care.
Chemotherapy? Or
No.
nothing like that?
Yeah, we've done
Yeah,
trials
we
of
we
chemo.
do, yeah. Right.
We don't have hospice. We have palliative care. So we don't.
Palliative. What is that?
Palliative is like the end of
End of
life,
life.
And you have certain parameters, but you don't have a hospice license, so you can't bill for your hospice. There's St. Joe's Home and Hospice has a hospice, and so does Home Health and Hospice. Those are the two. And I think you know about the hospice house in Merrimack. Most people do.
Right.
Now, by utilizing your services, you're not going to empty out the bank, right? I mean, if you spend a few weeks in the hospital, you're in trouble financially,
Right.
unless you've got a lot of coverage. This is an affordable way to maintain the health, to keep healthy, and having somebody. Is it just one person, or do a couple of you go in at a time? How does all that work?
People, if they just want home care services, will ask for us to come in and just talk to them and talk to their family. And usually they'll say, I want help for my mom or my dad, but they don't want anything. They're 82 and they can do it on their own,
They're
although they're
independent.
falling and they're independent.
Right.
So we just go and say, we can help you with laundry, because it's very hard for most people to change the bed and reach into the laundry bin downstairs that you haven't been down, and we don't want
is
you
a nurse
falling.
going to go do that? Really? A nurse is going to go and
A nurse will admit the patient, and then
Do
we
the
will
initial assessment. Yeah.
see what's going on with the patient, if there might be a little bit more, and then we will get a qualified individual, a patient care service representative, or
A nurse's aide.
or a nurse's aide, to go in there a couple times a week, whatever they want, whatever they're comfortable with.
Right. And you do the laundry, everything,
Laundry, prepare meals.
prepare meals.
It's really a great service.
Wow.
Home health, it really is.
Is there a website for people to go to?
Oh, yeah, absolutely. It's www.healthyathome.org. It's a nonprofit.
It's a nonprofit.
It's a
Okay,
nonprofit
so-
organization.
All right, and that's interesting as well. I'm just curious. Do you cover all of New Hampshire, or is it just Nashua? Or do you
The
go
greater
across-
Nashua area.
So you cross into Chelmsford, maybe Tingsboro?
No, we don't have a license for Massachusetts, so we don't cross into Massachusetts as of yet. But we go up to Keene. We have 3 or 4 clients up in Keene, and we go to Manchester and Concord,
Greenville.
Milford, Hollis.
Is there anybody out in Greenfield?
There is.
There is. There really is.
New Ipswich, and that's I think the people that really appreciate our services a lot more. Craig spends a lot of time out there.
They know that, when I get there, they know that it's like an hour away almost.
Right.
So I spend some time with them, and they really appreciate your coming out that way, because they know it's far from,
Civilization.
civilization is right.
So like one of the individuals that you go out, you do medication planners, because her dexterity or fine motor, she can't do it anymore, so you do pill planners, and her husband isn't well either, and they don't really want to know about the medications, and they don't want to know about how much they weigh or how much their edema is around the legs, but the doctor wants you to do that. And Craig is
I'll go out
phenomenal
there
at making sure
getting-
that they haven't comboed on the meds,
Right.
the 3 doctors.
Yep.
So he's kind of like the medication reconciliation liaison, and a lot of home care agencies do that now.
Yeah, you mentioned that off air, that you do a lot of pharmaceutical
Yeah,
evaluations, and
along with listening to their heart and lungs and what have you, and just making
Pet the
sure
dog.
that, huh?
Pet the dog.
Oh, absolutely, that's part of it. They look forward to me coming.
yeah, and
Yeah.
does it? When you hear stories a lot when you go to the hospital, sometimes, they were there and they got a staph infection. By being at home, does that kind of reduce that risk?
Very much so.
Absolutely,
Yeah.
absolutely.
It's just, you go to the hospital, everybody's bringing their diseases there. You figure it'd be a sterile environment, but People get sick at the hospital.
And not only that, but when people come home from the hospital, I think it's the patient's more at ease in their own environment, so it makes like their blood pressure more normalized. You know, you get a whole feeling for the patient. It's different than being in a hospital setting. It just works out better for the patient. They're more at ease. They don't have to get dressed. They can stay in their nightgown or sweatpants or whatever they want. You know, the idea is we're in there to provide a service and to make them as comfortable as possible while we're there.
And independent.
And independent. And you know, they're relying on you.
Right. You find situations where it might be a couple and one is playing the nurse and one is playing the patient, and the one who's playing the nurse can't play the nurse anymore.
Yes.
And it's very difficult, and they become overwhelmed.
Yes.
And
They don't know where to turn.
They don't know where to turn, and they want to invite somebody in. This is exactly what they can take that burden off.
And if there's financial issues, we have a case manager that actually helps them with financial concerns, any kind of social issues, and she's, you know.
The guru
Yeah.
for that.
Yeah. Great. Are there any other? I just think it's a wonderful service that you offer, and it's good that people know how to find you.
Right.
You're you're a phone call away. Oh, that's one other thing I wanted to know. Do you have those emergency things that if somebody?
Lifeline?
Yeah. If somebody presses the button, does one of you come with the EMT or?
No. When you have a personal emergency response system, or PERS, P-E-R-S, that's what people refer them to, they have to have an immediate family member that will respond, and then the second person can be a home care agency.
Okay.
A lot of home care agencies don't like to do that, but we've done that many times because there aren't any
And we're on
families in
call
Florida.
24 hours a day.
365 days. Someone is always there. We do weekend admission.
Phone call away.
Yeah.
And what's generally the time? I mean, how long does it take for you to get there? If somebody says, "Look, I really have a problem. I can't get to my meds." Or
Within 48 hours.
within 48 hours.
Yeah, but I mean, we can go out the same day if it's the meds, but with any kind of certified home care agency being discharged from a hospital or a nursing home, we work with the local nursing homes. We'll supplement care, so that if your mom is in the nursing home and wants make sure that she's in bed by 7 o'clock, not waiting till 9, because the nursing homes are well competent, or they're all competent. It's just the staffing issues because of the reimbursement rates and all the recent reimbursement rates, and healthcare is just, as everybody knows, it's just
Horrible.
it's just getting tighter and tighter.
Sure.
So they often will hire us to come in and help settle in mom for the night.
Do you now? I know that there's seniors. Do you work with younger people
Yeah,
as
we
well?
do.
Do you work with schools?
We do.
Interesting. You can go to a school. You're certified at the school.
We have some contracts to substitute for nursing. When their nurse calls out and they don't have anyone to replace, they'll call us to see if we have a nurse, an LPN or RN that would like to come from the day to go stay with the school with the children. But we have also we take care of children that are as young as 4 to 18 for cerebral palsy, for muscular dystrophy, for autism, for ADHD.
Asperger's.
Yep, brain injuries, all of that. So we have the whole gamut, from your private care that wants to have a nanny in the house to your youngest child that you need some respite so that when you come home you can at least get dinner ready for your other children.
Right.
Yeah.
Interesting.
Even well babies.
Do you ever visit daycares or anything like that?
We have many of our clients that go to daycare, but like Elvern, I think, is medical now, so they have their own nurse on staff.
Interesting.
And St. Joe's used to have a medical model too. So a lot of that times the client will go there for the day while there's more and more children taking care of their mom and dad in their own homes, or they've built apartments next to them so that
I
they
see
can
that.
work. And then while they're at work, they need to know they're safe. So we do safety checks too.
Right.
Just like Meals on Wheels.
Yeah.
People get Meals on Wheels, and there's that one safety check during the day that you know they're okay. And if they're not, then they have to call in. you know, and so they find, you know, ways. But, so
You
we do a
really
lot
are.
of that.
You really are like that Dr. Welby, MD type.
We feel we are.
We even drop insulin for
Yeah,
patients.
prep insulin.
And so because their hands are shaky, they can't do it, or they can't see, so we'll even go in and do that.
Yeah, well, that's why I meant at school, if there was a particular issue with one child has to have a certain medication. Can you go in and
Absolutely.
administer it instead of the school nurse? Are there different levels of nursing that you have to be qualified for? Or is it, you know, if you're a certified nurse, you can?
If you're an LPN or an RN, you can do it. Most of those trades. RNs can do ventilator care, PICC lines, which are intravenous. LPNs can take care of those lines, but they can't insert them.
Right.
But there's certain trainings that you have, but the basics are there.
Right.
Interesting. So the website again, how do we get there?
www.healthyathome.org.
Not the other one. Remember, it's Healthy at Home.
Healthy
Healthy
at
at
home.
home.
And the phone number.
595-4243.
And who will they talk to? You?
Linda Carter. They can talk to Craig Stewerman or anyone. We're
Linda Carter. So that's where the Wonder Woman comes
It
from.
is.
Linda Carter, the Wonder Woman. And Craig, you are Batman? What?
I answer the phone no matter what. I
Right.
mean, 24/7. If I'm awake, I answer my phone.
You're the
You
24-hour
know,
guy.
I don't shut it off.
Right.
It's important to speak to the patients
We're really
if need
proud.
be.
Right.
We're really proud of what we do.
Well, thank you very much for coming on Gate
Thank
City
you.
Chronicles, and we wish you the best, and we hope that other people will be able to find you, and you can be utilized and help a lot of people.
Thank you so much.
Thank you.
And thanks for watching Gate City Chronicles. That was a fast 28 minutes because that was very interesting. So until next week, thanks for watching. Thank you for watching Gate City Chronicles. And we want to thank our sponsor, Aardvark Dean of Clean, the carpet cleaner in Nashua. You can reach him at 603-630-1743. And if you would like some more information about Gate City Chronicles or want to be a guest, contact me at gatecitychronicles@gmail.com. Until next week, thanks for watching.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.